About 2.5 years ago, I found out that I have a rare cancer. They had to do 2 surgeries that were in my neck, in my face, in this area. Prior to my surgery, they told me there's risk where there might be some facial paralysis because of the location of the cancer. When I woke up from surgery, they immediately told me that the facial nerve had to be sacrificed and that I will have paralysis. So the entire side on my right side was paralyzed. And when I asked my surgeons what the next step was, because of the cancer and where it was, they needed to do radiation. So I was very thankful and grateful that they were able to get the cancer and that there was a plan. But then also I was having a very difficult time with my appearance, and besides that, the voice issues, the swallow issues. And so I was struggling with all of it, and up many nights, late at night, and started to look online and do research about facial paralysis. By the grace of God, I stumbled upon PNI, and it was within, I don't even know, it might have been that same day or within a couple days, he got back to me, and within that week, I flew out and met with Dr. Kochar.
Jennifer is a pretty amazing patient of ours. I still remember waking up in the middle of the night and getting an email from someone who I didn't recognize. And I opened the email, and it was a patient. It was Jennifer. She had just told me that she had just had surgery on her right parotid gland, and following the surgery, which they thought was going to be fairly routine, that they believed they had actually cut her facial nerve, and she had complete paralysis on one side. She was obviously devastated, and she was searching for someone to help, and she reached out to us at Pacific Neuroscience Institute. After evaluating her, she had a complete paralysis on the right side of her face. And after reviewing the operative report and discussing the case with her, she'd had a pretty severe cancer, which required removal of a portion of the nerve. She specifically had difficulty closing her eye. And that was something that repairing the nerve alone was not going to fix. So I enlisted the help of my colleague, Dr. Howard Kraus, who is a world-renowned expert in ophthalmology and plastic surgery of the eye.
Jennifer was referred to me by Dr. Kochar to address difficulties with Jennifer's right eye. When patients have a facial nerve weakness, one of the difficulties is with inability to blink and close the eye normally, which, apart from being painful, has the potential of causing significant harm to the eye with secondary exposure and abrasions and infections and severe problems with the health and integrity of the eye.
When I met with Dr. Kochar, he examined me and had all of my information, and he also went through what I could expect with the surgery, which was hard to hear, but Dr. Kochar told me, we can help you have a smile. It's not going to be the same smile that you had, but this will be a new smile. I was very happy that Dr. Kochar was so honest with me about what to expect. It was still hard to hear that there was no ultimate fix and that I would never look how I looked and have the same smile. But he gave me hope by telling me there were some options and that he could do this and I would have a smile.
We performed sophisticated microsurgery to reconnect her facial nerve and to also give it power from a branch of her masseter nerve. The nerve to the masseter is what helps you chew, and we were able to reroute that nerve so that it then connects to a branch of the facial nerve, and that was the branch of hers that had been cut. So we're able to rewire the hardware of her face so that she could help regain movement while the rest of her face was recovering from that initial surgery. Her eye before surgery was completely paralyzed, and her eyelids were, and she couldn't close them at all. And so the work that Dr. Kraus did really did not only help to make an improvement in her facial symmetry, but also in the recovery of her eye and her quality of life overall.
We created the plan to operate on both the right upper and the right lower lid, to lower the right upper lid to allow it to better protect the eye, and at the same time to raise the right lower lid. And this allowed Jennifer to have a complete blink with closure of the eye. She didn't recover normal muscular function, but nonetheless, the surgery of the eyelids allowed her to have a more complete blink and allowed the cornea to be adequately protected both during her awake and sleep procedures.
The eye surgery that Dr. Kraus did for me helped me be able to close my eye completely, be able to have an appearance where they're almost the same. That eye surgery allowed me not to have further issues with my eye.
It took approximately 3 to 6 months for Jennifer to start to regain movement. In fact, because she was out of town, our follow-up visits were done virtually, and it was on a virtual visit that I actually noticed her face was moving before she did. It was a pretty exciting moment for all of us because she wasn't even cognizant that she was able to move her face and to create a smile, which she had been absent for about 3 to 4 months.
After several weeks, we had an appointment and he had me bite down. And when I bit down, the corner of my mouth came up, and that was the first time that I knew that it had worked and that I had some hope to have more facial expression and a smile.
Today we are almost 2 years from that initial email that Jennifer sent me in the middle of the night. She has not only recovered from her facial function, but she is a cancer survivor. She has completed her radiation. And at this time, we really do routine maintenance therapy for her. We've done some small in-office procedures to help with her symmetry periodically. She does have some permanent nerve damage from the time that her muscles were without input. She has some spasms of the face that most patients with facial weakness or facial nerve injury have, called synkinesis. And we treat that in the office with botulinum toxin, as well as physical therapy.
My experience with PNI and with Dr. Kochar and Dr. Kraus has been the best experience after having cancer and paralysis. I could not have asked for a better team who's more understanding and attentive and able to understand the importance of timing the results. I really could not have asked for more, and because I can't go back to how I was, that option wasn't there. And so what he was able to give back to me means the world to me.
When I think about patients like Jennifer, it's hard not to get emotional. Patients like Jennifer really have to fight for themselves to get the care they need. There's very few places that have people with the expertise like Dr. Kraus or some of our other experts. And we're very fortunate to be able to offer this care to patients like Jennifer. And it's a true testament to our staff and to the team at Pacific Neuroscience Institute that someone can reach out to our office in the middle of the night and be seen a few days later, and that we can offer them the quality of care and the expertise. But patients like Jennifer are why we do this work, and we're grateful that they trust their care with us.
I can't express enough how fortunate I was to be able to stumble upon PNI and to be able to find on that website all the information that gave me a little bit of hope. But then again, to call the office and have the first person I talked to be so receptive to what's going on and have them talk to the doctor, to Dr. Kochar, immediately about my situation. It's unheard of to have that kind of service, and I am very thankful and fortunate that Dr. Kraus and Dr. Kochar were able to help me